Joint-related medical conditions affect 1 in 2 adults. That's nearly 127 million of us. And when chronic joint pain interferes with your life, preventing or limiting you from doing work or other activities you enjoy, and if treatments like medication and physical therapy aren't relieving the pain, it may be time to talk to your doctor about surgical options. Dr. Wiater, orthopedic surgeon with Beaumont Hospital, is here to talk to us about the great strides being made in joint replacement therapy. Welcome aboard, doctor. Great to have you here.
Hi, Wyatt. Thanks for having me.
So, question one, what causes joint pain and why do we experience it?
Well, there's a number of things that can cause joint pain, and two of the most common causes would be a traumatic injury to the joint or arthritis. So a traumatic injury can affect patients of all ages, and that could be a fracture of the bone in the joint or a soft tissue injury like a tendon, ligament, or cartilage tear. And arthritis is a very common cause of joint pain, and it's the most common cause for patients over the age of 65. And arthritis is a degenerative process. What happens is that the cartilage that normally covers the ends of the bones breaks down and the bone underneath becomes exposed. That bone then can rub and grind together and lead to a very painful joint.
Why are the number of joint replacement surgeries increasing so much, and how would you know if you're a candidate for joint replacement?
Well, the volume of joint replacements is increasing dramatically, and there's a couple of reasons for that. One is that the population in the United States is aging, and it's estimated that by 2050, 1 in 5 Americans will be over the age of 65. And as we know, the older patients are the ones that tend to have arthritic joints that become painful and need to be replaced. Another factor is that patients are more active than ever, and they're staying active into the middle-age years and beyond. And that activity can place demands and wear and tear on joints that can lead to pain. And finally, unfortunately, obesity is a problem in the United States, and right now 1 in 3 adult U.S. men and women are considered overweight. And being overweight places a lot of demands on the joint and can lead to problems, particularly in weight-bearing joints like the hip and knee.
If someone undergoes joint replacement surgery, how long does that recovery last?
Well, it's a long answer, and I'll try to keep it brief. It depends on a lot of factors, one of which is the patient, him or herself. So patients who are in good health and relatively fit can expect a quicker recovery than patients that have medical illnesses like diabetes or obesity or are not fit going into surgery. And finally, it depends on the operation that was performed and how damaged the joint was. But I think in many cases, patients who are in relatively good health and have an uncomplicated joint replacement surgery can get back to simple daily activities and maybe a desk-type job in as little as 3 to 4 weeks.
We hear there are some newer joint replacement options available. Can you just highlight those briefly?
Sure. In shoulder surgery, which is what I do, there's one called a reverse total shoulder replacement, and that came out of Europe about 20 years ago, and we've been able to offer it in the United States for the last 10 years. And what that involves is replacing the shoulder joint, which is a ball and socket joint, with a metal ball and a plastic socket. But it's different than the standard shoulder replacement in that the metal ball and plastic socket are reversed. And we're able to offer that to patients with arthritis and badly torn rotator cuff tendons. In the hip realm, we're able to offer anterior total hip replacement surgery, which is gaining in popularity, and that's a muscle-sparing technique that decreases the risk of the joint dislocating post-operatively and allows a speedier recovery. And finally, in the knee, we're able to take cartilage cells from the knee joint from a patient, culture them in the laboratory, and then go back for a second surgery to reimplant a soft tissue graft made from that cartilage that can fill in an arthritic defect and hopefully delay or even eliminate the need for a knee replacement.
Dr. Wiater, thank you so much for joining us today.
Thanks, Wyatt.